Welcome, and thank you for joining City Parks Alliance for this discussion about how park leaders are adapting to challenging circumstances as well as we all strive to serve our communities during this unprecedented time. I'm Nancy Goldenberg, co-chair of City Parks Alliance and president and CEO of historic Laurel Hill Cemetery in Philadelphia and West Laurel Hill Cemetery just across the Schuylkill River in Montgomery County, Pennsylvania. I'll be moderating today's discussion. With heightened concerns over COVID-19 forcing people indoors, park leaders now find themselves needing to balance between what seem to be competing needs. On the one hand is the critical need to help communities maintain wellness during this stressful time by providing access to safe outdoor spaces for both physical activity and mental relief. On the other hand is the need to follow social distancing, public health guidelines, and local directives, which vary in restrictiveness from city to city. Today we'll hear from park leaders in 3 cities: New York, Pittsburgh, and San Francisco. We'll hear how they're educating residents to safely utilize parks and trails, how they're adapting existing programming to meet current needs, and how they're adjusting their messaging in creative and strategic ways. With us today are Mitch Silver, Commissioner of the New York City Department of Parks and Recreation, Jane Miller, President and CEO of Pittsburgh Parks Conservancy, and Phil Ginsberg, General Manager of the San Francisco Recreation and Parks Department. We'll begin with a discussion with our speakers, and there will be time to answer your questions as well. We have an amazing turnout for this webinar, and to ensure we can respond as questions or technical difficulties arise, I'd like to give you a few tips. First, to ask a question, click the text box underneath the question toolbar on your GoToWebinar control panel. Type the question in the box and hit send. Feel free to send questions throughout the discussion. Given the size of the audience today, please know that it's unlikely we'll be able to answer all questions, and we apologize in advance if we're not able to get to yours. Second, if you are experiencing a technical problem during the presentation, please type it in the box and send to us. Next, please note that you have 2 audio options: joining via phone or using your computer's audio. If you're having trouble with the audio, you can go to Audio Toolbar on your GoToWebinar control panel and click the option. Please note that since our speakers are doing this webinar from their home, they may be turning their webcam on or off during their connection issues. And finally, if you miss something, don't worry. Links to today's recording, as well as related resources, will be emailed to all registrants. Lastly, City Parks Alliance is striving to adapt its programming to be responsive to the changing needs of park professionals during this challenging time. Support from our members is critical to enable CPA to continue offering this type of programming. We hope you'll consider joining CPA if you aren't already a member. To do so, please visit cityparksalliance.org/join. So let's get started. Here's the first question for our speakers. How is your agency responding to the many changes and challenges brought about by COVID-19? And in particular, how are you balancing the need to follow local directives with the need to provide access to safe spaces to help residents maintain their physical and mental wellness? Mitch, why don't we start with you?
Sure. Well, thank you, and I hope everybody is staying safe. First, in New York City, we're in what we call the pause, which is basically somewhat of a shelter in place. We are allowing people to go out for their daily tasks, and exercise is included as one of those daily tasks. For the time being, our parks are open. Our fields and courts are allowed for solitary exercise. Group play is not permitted. And for the time being, our playgrounds are open, but there is caution signs basically saying use at your own risk. everything is changing day by day, and so we'll be evaluating how people are self-distancing within the parks. We're using messages across the board. We have multiple conference calls a day, both at City Hall with my senior team, and then pushing it out to staff. And we're also just making sure that we're staying up to date. But as I said, everything changes day to day. We're listening very closely to our health professionals, putting out multiple signage, both in our parks entrances, about using proper hygiene and social distancing. And starting yesterday, we now have the police department, we have the Parks Department, enforcement police, as well as enforcement agents from other agencies, basically becoming social distance ambassadors, going out in various parts of the city to make sure people understand they have to social distance. Right now, the enforcement is just education only, but we're looking at other remedies should people not cooperate and not comply, and we may move to a more severe measures of locking playgrounds and fields and courts, but we're taking it day by day. So for us, there was a Times article a couple of weeks ago, I was interviewed last week, in fact, that people are saying, wow, everything is closed. Park is the only area that's open. It's free, and people are thanking us that they have a place to go to while schools are closed, just to get some fresh air and enjoy the outdoors. Physical health, mental health, boost the immune system, and at least from a distance have some social contact. So that's the approach we're taking right now in New York, but as I said, it's literally changing hour by hour, in some cases day by day.
Mitch is waving, so that means he can hear me. Okay, great. All right, well, good morning, everybody. We'll start over. It's been a really intense time for parks, right? Mitch and I, by the way, probably talk almost every day or several times a week, as I'm doing with a lot of our big city directors, and he's right that it's a very fast-moving situation. Although New York seems to be quickly and sadly becoming the epicenter in the United States, a lot of this started in the West Coast in Seattle and San Francisco. Right now, here's the status of our park system. All of our programming has indoor and outdoor programming and permits has been suspended. Our parks are open, but we have taken an additional step, which New York has not yet taken, in closing some of our smaller playgrounds and putting closed signs around play structures. One of the things that we have done, which we're quite proud of, is we have converted all of 35 of our recreation centers around town into emergency child care operation centers. So because our schools are closed now through May 1st, we are providing child care to all San Francisco healthcare worker families and to those city employees activated as disaster service workers, K-8 child care with 3 meals a day. I think the biggest challenge that I would say we're all facing is the difficulty in messaging. On one hand, Nancy, as you pointed out, parks are, and as Mitch pointed out, parks are vital right now. They're more important than they've ever been. And from a professional urban parks perspective, people are realizing what we've been saying all along, which is not that parks are not nice to have. Parks are must-haves. Parks are essential services. Our workers are essential. Our spaces are essential to physical and mental well-being. And so we're seeing heavier park use maybe than we've ever seen. People are complying, by and large, complying with social distancing guidelines. Not everyone, but most people are. But I think the challenge is we're all outside complying at once. And so we're seeing extremely heavy park use, which is creating some dilemmas and challenges. Our messaging is please get outside, get some exercise, connect with nature, but don't gather and find your own space. So we have lots of social distancing, physical signage throughout our park system, lots of social media, Instagram. We're in the process of actually trying to find San Francisco athletes or Bay Area athletes and celebrities who are probably more effective at messaging than a single government agency might be to echo the social gathering messages that we're articulating. And I'm really proud of my staff. We've got great attendance, really high morale. Our custodial service, our custodians have become literally public sector heroes because without them, everything gets shut down. So between my custodians, our recreation staff who are now in the child care business full time, our park workers who are keeping our parks clean and safe, and then of course our 40 administrators who are all part of our Department of Emergency Operations team, we're doing okay.
Thank you, Phil. Jane, how about you?
Yeah, so, we are facing the same challenges, obviously not to the extent that New York is facing or even San Francisco at this point, but we are under a stay-at-home order, and that in and of itself has impacted us. All of our facilities, as well as city facilities, programs, events, and playgrounds are closed. And we are, one of the key things is incredible coordination internally in the organization to make sure that everyone is on the same message and that staff know what decisions are being made in advance to what we share with the public. And then obviously regularly and throughout the day, updating our messages as requirements change. We also are trying to not appear tone deaf to the pandemic, but also realize that there could be COVID message burnout from organizations all over. We are seeing the same impact that San Francisco and New York are, which is the value of parks. Fortunately, we are in a city where people really value their parks. But during this time, even when it really started hitting early on, a couple of weeks ago, park usage was up. Social media, pictures and people walking in parks and being in parks really had shot up significantly. And so we are keeping all of our parks open for walking, running, bicycling, and really also ensuring that our messages that go out to the public are in alignment with whatever government regulations have also been put in place. Just as New York and San Francisco were using multiple media outlets, social media, email, blogs, photos. We're also working with media relations. We have gotten a lot of press coverage about the downtown is shut down, but the parks are overwhelming with people. And people really get that this is essential. And when the schools closed, we also shifted our messaging to help parents have alternative ways and suggest activities that were safe for them to do with their kids or the kids could do. We're also doing virtual environmental education to help with homeschooling for kids. We have a very strong environmental education program, so we're creating videos and webinars for parents and families to use for homeschooling. We're taking our horticulture and forestry staff and encouraging them also to develop videos and webinars. While people can't do work in their parks, they're home. If they can, we can help them use new tools for green infrastructure and things that they can do in their home to take care of their plants and their trees. We're doing that as well. We're leveraging graphics and memes to communicate key messages. And we've also created an FAQ. What we're really trying to do is create multiple message ways because people take in information differently. So we're doing FAQs, we're doing memes, we're doing graphics, we're doing press coverages in a variety of ways. And we're also being very careful to not say things have been canceled, but to say that things have been postponed and that things will be rescheduled. And so that's really important while we are also advocating safety and saying that people's health and wellness and safety is the number one priority, and how they use those green spaces and parks and trails is really important. We're also considering opening up some of the roads that go through our larger parks to provide more expansive places for people to walk as parks are getting more and more crowded. We're also paying attention to what's going on in Florida and California with beaches and parks being closed because of the heavy influx of college students. And we're preparing ourselves in the event that locally they want to close parks because of what they're seeing happening in Florida and California. And we're really going to push against that because as we all know, park space is critical for our own physical, mental, and emotional well-being.
Yes, thank you, Jane. One question I think that a lot of folks have is how you're collaborating with your various public health officials regarding policies, be they governors or county officials or mayors and city council folks. So maybe each of you can speak about that collaboration and cooperation and just how you're figuring out policies during this time. And maybe we'll go back to Mitch if you can talk about that. Of course, New York have a lot going on right now, so we'd be interested in hearing about that.
Well, in terms of my role, we have our continuity of operations plan is activated, and so we all knew in advance what our role is. So in terms of my direct interaction with our health officials, my chief of staff has another contact in our operations center, which has been activated for quite some time. As you all know, half of the cases right now in the United States is New York, so things are moving very quickly. The main thing we're asking for is for our employees. One, we're giving guidance to the public, but our staff who still come in the field, I have 3,200 essential workers. The admin that can telework to support our maintenance and operations are working at home. I'm still in the office. If not, my floor is almost vacant except for maybe 5 people. I have an agency of about 7,000, so it's just to support those services. But the leave policies, what do I do if I come in contact with someone? I'm cleaning a comfort station. We make sure we have the PPEs for everyone. So we're getting guidance. The changes, there was some change in policies about the leave policies and some guidance about if you came in contact with someone or someone in your family was in contact. The leave policy for us, that was just for staff, became a very important topic. So we provide clarification. We have one point of contact, not speak to your supervisor or this person, that person. There is one email, one contact that you can call to actually get that information, as well as reasonable accommodation based on CDC guidelines about people in terms of just their condition, their health conditions. So for us, we're listening very closely to our health officials about how do you clean, what happens if there's something positive in the organization. Because of HIPAA and confidentiality, we're not disclosing things to staff, but we do know when we clean a space, how much time before and after do we actually sanitize and disinfect the location before people can return to work. So on the staff level, that's what we're focused on, very closely to the health professionals. But in terms of my daily contact, we have our contacts with the health department so I can focus on keeping our operations open. It's primarily, just like the others, all of our rec centers, our programming, everything is stopped, which is down to our M&O responsibilities and forestry. That's what we're down to. And then all the support services, the technology, because we've never done telework before. I have close to 1,800 employees teleworking. We had to quickly order laptops. And so just in terms of that information and guidance, primarily my staff, chief of staff to the chief of staff at the health department, and then anything else we get directly, almost on a daily basis, from the health department.
Thank you, Mitch. Phil, how about you? How are you communicating with all of your public officials in terms of developing policies?
So our city, since the mayor declared a local state of, so in San Francisco, the mayor declared a local state of emergency. And since the governor has declared a state of emergency for all of California, James, can you hear me? I'm assuming people can hear me. I'm just going to keep talking. So the city's operating through an emergency operations center. We have no org chart.
Yes, we can hear you.
We operate using an ICS or incident command structure based on the national incident management system. There's a long delay, guys, in between the time I'm talking and the time you're hearing me, so forgive me. I participate on a citywide policy group with city leadership with calls every evening at 6 o'clock. And then at a department level, we are operating with a department operations center that has an operations section, a logistics section, a planning section, public information branch. We have department operation calls every day at 1:30, and then department policy group calls every day at 3:30. And then our emergency childcare operation, also, which is a multi-agency effort, also has a emergency call every morning at 10 a.m. So I'm basically on calls all day long with some work in between, day and night. We are also spending a significant amount of time doing Zoom calls and other sorts of conference calls with different segments of our staff. So they're hearing from me and my leadership team directly. Yesterday, we spoke with all of my park service area managers because all of our gardeners are working, and they wanted to hear from me and I wanted to hear from them. I wanted to understand what was happening in the field. Regarding policy guidance with our relationship with our health department, look, on this particular crisis, it's a health pandemic. Let's be clear, the health department is in charge in advising the mayor and our elected leadership and how to respond. We are supporting the health department. We are implementing direction, frankly, from the health department that is intended to minimize risk. And every decision we make is about prioritizing health. And I think the tension point in that, in a parks operation versus a health operation, is exactly what we've all been talking about, which is our deep, profound belief that that we all need to maintain physical health and mental well-being as we work through this pandemic, and that parks are an absolutely essential part of that solution. And so, for example, one tension point, which I know New York City has been discussing, is a very, very, very strong desire from San Franciscans for more car-free space, under the theory that with more car-free space, we can all be outside more and be effectively socially distancing. In San Francisco, we were supportive of that proposal, the Parks Department, but in San Francisco, our health department did not support the proposal. So we are not opening up more car-free streets because of a concern about, frankly, over-exuberance and having too many people outside. We expect that in San Francisco, these next basically 10 to 21 days are really, they talk about it in the health context as a potential surge of people becoming symptomatic and then becoming sick and overwhelming our healthcare system. So while every decision we make as an organization is about prioritizing health, we are in essentially a support role and are following direction using our emergency operations and national incident management structure. We are taking direction really from our health department and our mayor. We are asked to contribute and to offer our guidance and our opinions about different issues, but the health department is the captain of this team.
I will jump in to help
you,
prevent
Phil.
some of the delay.
And by the way,
Phil.
the mayor's the general manager, just to be clear.
But here in Pittsburgh, since we are a conservancy and the nonprofit partner to the city, we are in a different role than Mitch or Phil are in San Francisco. So we have a very close relationship with the city. So I'm working regularly with city DPW staff and Parks and Recreation staff to make sure that we are having a coordinated approach in terms of tackling issues in the parks and how to deal with maintenance activities, how to approach programming and what facilities and operations are closed, so that it's a seamless approach for both organizations. I agree with Phil, the health department is the lead. Any decisions the health department makes, we are following their lead. And then if the city entered into emergency operations a week ago, and then last Wednesday they went into level 2 of emergency operations. So we are simply following and mirroring both what the local health department and state, the governor is doing, as well as what the mayor is doing, and ensuring that we are in absolute compliance with what they're doing. And then obviously coordinating really closely with city staff around park service delivery.
Thank you. So some of you touched on programming in your answers to the previous questions, and particularly some of the programming for those who are out of school and young families. But what about our other populations, for example, the more vulnerable folks and other residents throughout your entire cities? Wondering how you're supporting them and how our parks are supporting some of those folks in this time of great need. Let me start with Phil.
Sure. I just noticed I've been answering all these questions on this chat, but apparently I have to switch a setting so that they're going to the audience and not just the organizers. Somebody can help me do that. Our city obviously is very, very, very focused on our most vulnerable population, both within the construct of equity and then more importantly right now within the construct of the definition of vulnerable population with respect to this pandemic. Our city's response is very focused on care and shelter for our vulnerable populations, messaging for our vulnerable populations, community outreach. So one small example, as Mitch said, our park rangers, like in New York, our park rangers are working with our police department to educate our city about the importance of our social distancing guidelines and not to gather. We are a very diverse city, a very multilingual city. One of our oldest public spaces in San Francisco is called Portsmouth Square in Chinatown. And we have a lot of monolingual Chinese speakers who live in SROs and for whom Portsmouth Square is their only living room. And there we have assigned full-time park rangers who are Chinese speaking just to make sure people understand that this is not a time to gather, come out, walk around, get some fresh air, but it's not business as usual at Portsmouth Square. The most difficult decision, frankly, that we made, and another tension point with the health department, was the closing of some of these smaller playgrounds. Many of our spaces are not lockable, right? We have play structures that are not locked in big parks that are not lockable. We do have in some of our neighborhoods, and they tend to be our highest density, low income neighborhoods, small neighborhood spaces where there's a children's play area and a few benches and a space for some Tai Chi or were really well used and frankly freaking a lot of people out. And so there was a decision made to close them. I was very, very reluctant to do that because in some respects, even though there is some risk in using those spaces, the people who are using them are often living in very small, cramped spaces. And so, we need to be mindful about health generally, about people's blood pressure, about people's mental health. And so these are some of the trade-offs. And there are some very serious sort of equity considerations. It's much easier for, some San Franciscans to get to Chrissy Field or Golden Gate Park, or even though they're not supposed to, drive over the Golden Gate Bridge and go explore a beautiful rural park in Marin County, while we have low-income, vulnerable communities in some of our poorest, most underserved neighborhoods in San Francisco that really have no place to go. And that, for me, is my biggest concern. And again, you have to stay in your lane during an emergency, and this is not my shot to call. So I am following direction, but I have a lot of angst about that.
Mitch, how about in New York and the vulnerable populations that our parks serve?
Well, we certainly are telling those that are 70 and over, those that have health conditions, they can go out and exercise. We tell them exercise caution, but we definitely say solitary exercise only. We're seeing some of our senior population walking their dogs, and as we're going out telling people to social distance, please give them as much space as possible. Our recommendation is stay home, but we understand those that are pets, or if there's someone that they know that can volunteer to take their pet out so they don't have to do that themselves. We're also starting this weekend, we're activating a lot of our online programming, something that James said. We've always joked around with the Department of Fun, and so my staff has gone to work, and you can think of everything from yoga to shape up to art that kids can be involved in. Schools are closed, but they have launched online learning. But after hours, we're also encouraging people to take advantage of all that programming. Some is a live feed. We're doing tours with our rangers, live feed in the park. We already did one for our cherry tree exhibit since it's spring here in New York. So people can feel that they're outdoors if they can't go. So certainly, if our senior population have access to their computers, they can certainly do that. In addition, we're now using Zoom and Google Hangouts more and more. So we're encouraging people, whether some of the commissioners are having a happy hour or a debrief at night, we can all come together. So whether it's Zoom or Google Hangout is a way of connecting with others. And I thought it was a joke the first time. I had such a great time. It's so much pressure here in New York that just for all of us to come together, because our last conference call is about 8 o'clock. And so around 8:30, we all get together for about an hour, and it really starts to relieve stress. But I'm surprised how connected you feel just from seeing someone you know and just be able to unwind for that evening. So we also want to share that with those that have that capability. And we now have a phone bank of people reaching out to seniors just to check on them to see how they're doing. So that's growing a little bit over time. But some of our rec staff, since they're closed, we now redeploy them so they can help with our food distribution centers or make some of those calls for those that are isolated. But in terms of the programming, start checking out New York City Parks on Twitter or Instagram, and you can start to see some amazing stuff. I wish I could tell you what it is coming out this Friday. I saw the preview. It is amazing, and they're actually out there doing work, and I shot one earlier today about social distancing. All of our messages talks about washing your hands, social distance, don't touch your face. I did it twice during this video, so I'm getting super conscious about even touching my face. That we embed those messages. We understand people are isolated, and they need to be connected. So we're finding out that phone, computer, iPad are becoming great devices and great tools to keep us all connected.
Thank you, Mitch. And how about you, Jane? How is Pittsburgh dealing with the more vulnerable?
So we were fortunate that over the last year, we went through a really extensive process of developing a long-term equitable investment strategy for the entire park system, where we're about maintenance, programming, capital projects, and rehab. And it is completely about investing in parks across the city, all 165 parks across the city, in an equitable manner. Fortunately, we had a referendum that passed, and it is currently under discussion with council. And so while there is less work we are doing as a conservancy around specific response to the more vulnerable, other than what we're doing in terms of across the whole city, that the city of Pittsburgh is doing work in that area. But in my view, the silver lining of this is that this is happening right on the heels of what we have done over the last year and a half to build community consensus about reinvesting in parks that have been woefully underfunded for years and decades, and how critical they are in the most vulnerable communities in the city. So I'm looking forward to, as we get through this, implementing that plan with the city of Pittsburgh, because it has become, because of what's happening, the clarity of our message prior to this around a long-term investment plan for the entire park system. It dovetails nicely in the situation we're in, even though this is not a place we want to be right now.
This is Karen jumping in with the audience questions. Can you guys indicate if you're hearing me? Just give me a thumbs up.
Yep.
Okay, great. Okay, let's move into some of the questions about staffing.
Yep.
A lot of people are asking what you're doing for your staff who are no longer programming. Are they getting hours or doing other things? You talked about that a little bit with your programming here, but how are you handling that, and have you had to take any staff off schedule? And in answering, how about if we just go Phil first, then Jane, then Mitch?
Sure. Here's a quick overview of how we're approaching staffing. Everyone in our staff, our entire organization has been categorized basically by function. We have disaster service workers who are directly involved in the COVID-19 response. Those people include all of our recreation staff who are now operating emergency child care centers. It includes our park rangers who are enforcing or educating about social distancing. It includes our custodians, without whom none of it operates. And it includes the 40 some odd people who are assigned to different branches in our own department operations center. And by the way, we do have staff that's been activated for other roles citywide, truck drivers bringing in RVs and shelters to quarantine homeless positive tests, people who are homeless who've had positive tests. So that's category 1, or disaster service workers. Category 2, again, our entire organization is divided by function: essential workers and non-essential workers. Essential workers are people who are required for the continuity of our operations. They include all of our park maintenance staff, because our parks are open and they're very important assets from an infrastructure perspective. You can't just walk away from a park or even a golf course without the asset being severely damaged. So they are all essential. In the category of those who are essential, we do a further breakdown and say who can telecommute and who can't. If you can telecommute, you are telecommuting. And if you can't, you're coming to work. And obviously we are working with our staff and educating them and providing them all the information and listening to their concerns about health and safety and making sure that they can do their work in a safe and healthy manner. Then we have non-essential workers, and that's not a diss on the employee, that's the function. The function itself is non-essential right now. So all of our philanthropy and partnership work, some of our volunteer operations, some of our permit operations right now are non-essential because we're not doing that work. If those employees can have work that they're all home. But if some of them can do work via telecommuting, then they are. And if they can't, they are on a temporary furlough, which is a citywide policy, which does allow them to continue to be paid at least through April 27th. You do have to be a permanent and regularly scheduled employee to receive that paid furlough. So I think some of our temporary workforce, or as-needed workforce, does have some challenges. Fortunately, we're using most of them because we have a lot of as-needed custodians, as-needed park rangers, and as-needed recreation staff that are all performing either essential or disaster service worker functions right now. That's essentially how we're managing the allocation of our staff. Oh, and if you're vulnerable, if you're in a category of people who are older than 60, you are encouraged to stay home. We are not asking people for sick notes. We're really trying to meet people where they're at. We understand that there's a lot of angst. Our attendance is good, but we certainly are being very tolerant of people's desires to be home. If you decide to be home because either you are not well, which you're not feeling well, which is when, of course, you have to be home, or you have a family member who's become symptomatic, you are asked to stay home. You're supposed to use your own leave balances in that case.
Thanks. So for the Conservancy, as a nonprofit organization, we get no public funding for our work. Everything that we raise in our annual budget is through private fundraising that we do. And so we began actually last week early on looking at our cash flow situation because we don't have a regular source of revenue to keep all of our operations going. And so we are looking at it relative to the entire 2020 calendar year so that we can remain solvent as an organization through this. And all of our staff, we were having some of our staff still out in the field, but when the city went to a level 2 emergency operations status and they pulled all of their field staff in parks other than critical work from the field, then we had to pull all of our field work as well. And so most all of our staff are working remotely, and we are now we just are in the process right now of reevaluating since we went to a stay-at-home order on Wednesday, and all the businesses and other organizations that are shutting down and laying people off, we are in the process of reevaluating our financial situation. But our goal is to be solvent, not only through this year, but for the long term, to implement the work that we've been doing for 25 years. But again, because we are a nonprofit and don't receive any regular revenue from property taxes or any other tax, we are in a much different situation than other city park agencies.
In New York, we have, just like San Francisco, we have essential and non-essential workforce. both the essential either have to come in or their their administration so they can telework. In New York, we made a decision because the epidemic is so severe here. I think we're close to 15,000 just in New York City alone, that we wanted people to go home. So our non-essential workers are going home with pay. Now, there are others that are being called back as needed. We have our food distribution centers. We're looking, right now, New York City is serving school children meals 3 times a day. It's available at the local school. They can pick it up. And we're now contemplating also delivering food to senior population. So potentially they can be used for those services. So we did let some of the essential employees that could not telework, they're on call, but both essential and non-essential at this time, they're all being compensated.
Okay, thanks very much. And Jane had touched on some of the budget implications, immediate and long term, and obviously as a nonprofit, she has some different issues. I was wondering if Phil and Mitch, if you guys could address what you see as the short-term and long-term budget implications. In particular, a lot of people are asking about, a lot of their revenue comes from earned revenue sources, which are now being canceled. So let's start with Phil, talk about short-term, long-term budget implications, and then Mitch.
They're both very dire. Short-term, a little bit less so because we operate on a July 1 to June 30 fiscal year. And so we're in March. We're in our 4th quarter, but we will earn 0 revenue through June 30, 0. That has an impact to us of about $20 million. Our annual operating budget is, we're much smaller than Mitch, but we're around $200 million, and it comes from 3 sources, all of which are quite vulnerable now. One, earned revenue, where again, we have been earning through March, but frankly, we have tons of small businesses in our parks that are operating concessions that were going to use March revenue to pay, February's rent or minimum annual guarantees, right? So we're really getting 0 from February through June 30. No permits, no special events. Our parking garages are essentially closed. All of our concessions are closed. We have no recreation program fees, none of it. And I anticipate, nobody has a crystal ball to know when we're going to be back up and running with a normal operation, but I think it's going to take a long time, because even when we're cleared to resume normal operations, it's going to take a long time, I think, for businesses to come back. We're going to lose some, and our political process is very difficult for replacing them. We need to put out an RFP, and there's a lot of community dialogue, and everybody's got an opinion about, what kind of coffee they want served in their parks. So I think the earned revenues is going to be, right now it's 0, and I think it's going to be below budget for a long time. The other 2 sources, we receive something called an open space fund allocation, which is a share of the city's allocation of state property tax revenues. We receive 2.5 cents for every $100 of state property tax, and there is no property being bought and sold right now. So transfer taxes, which are a piece of that, are going to be low. So I'm quite worried about our open space funding, and then the city's general fund. We like to call that the money we beg for. We've got a transportation agency that has just stopped running its train system. We have a number of city agencies whose resources are being stretched. So we have a 3-month lookout, which how I got to the $20 million number, but I think that the budget consequences, unfortunately, are going to be dire for a long time.
The same in New York City. I want to be careful not to make any news. We're getting now information from our budget office about the impact. I do know the governor said for the state of New York, fighting this virus could cost us as much as $15 billion. I don't know what the number is for New York, but we're very concerned. We're going through budget exercises. In fact, this morning, we know our partners that rely on fundraising and events. We told them that you really can't make any purchases right now, but this is important for them to sustain themselves. We're very concerned what this means for our partners. They basically focus on earned revenue and galas and fundraisers, but right now everything's on hold. So we don't know the fate of our partners. There's so much we don't know. but we started some very serious and dire budget exercises this morning. And I don't want to make any news, but we know it's not going to look good, and that's just the short term. The long term, we'll see what happens, but short term, we're very, very concerned. I'm sure all of us are in the midst of hiring our seasonals for the summer, and there's some definite revenue issues happening right now. So we're trying to work that out so we can figure out what to do. But it is serious, it is dire. But again, New York City, at our scale, our budget's about $580 million. But right now, a lot of things, we're looking at our construction, we're looking at our contracts, and we're just making a day-by-day decision, work with our budget office. But things right now are not looking good.
Mitch, you had mentioned seasonal hirings, and there were quite a few questions around that, how you're all handling both seasonal hires, but then also volunteer stewardship. I know that's a particularly important approach for all of you. Why don't we start with Jane to talk about, what you're doing about volunteers, what you're thinking about that in the future, seasonal hires, and then we'll have Mitch and then Phil talk about seasonal hires and volunteers.
Yeah, so great question. Fortunately, we have a number of full-time vacant positions that are open that we were literally getting ready to post and start filling. We've put all those on hold. We have some part-time staff on board right now for critical parts of our organization. And we have some critical positions that are for our summer seasonal spring seasonal positions that we're posting so that when we are able to be up and running, we can get those staff on board, but we're not doing any hiring right now. We're just positioning ourselves so that when we are ready to roll, our capital projects, our seasonal hiring, our program summer camps and activities, we're positioning everything ready to go so that we're not delayed when we're back up and running, but we're not hiring. We're just getting ourselves positioned and ready to go. Again, both from a realistic perspective that we don't know how long this is going to last, but also from a financial perspective to minimize our losses and ensure as much as we can the strongest financial position we can be in coming out of this. And we've also ceased all volunteer activities as well, because from a safety perspective.
I don't know if it was Phil or I'll just
go ahead, Mitch.
All right. Same as Jane, we're not allowing any volunteer programs to go forward. We can't assure both. We have an order in New York that there's basically no gatherings in New York, which basically we're defining as more than 5 people that are unrelated. So that's something we're not going to encourage and cancel all volunteer events. In terms of seasonals, right now we're taking a pause. We're waiting for the budget office to tell us. We've given them the ultimate dates that we need to make a decision at this date before we decide what happens to our seasonals. And so we're in daily contact with our budget office, or I should say they're in daily contact with us about moving forward with those seasonals. And so that is to be determined, but for the time being, but prior to that decision to put a pause, we were doing social distancing interviews in all of our borough offices. But for now, it's a pause until we can make a determination about what's going to happen. But like I said, as you all know, we all rely on seasonals, particularly in peak season. And so we just want to be very respectful of the budget office and see how it unfolds. And like I said, it's changing literally day to day. Well, let me make a correction. I do believe we're still doing the interviews in a social distance, but in terms of actually bringing them on board, we're waiting for guidance from the budget office, but we do have that date where we have to make a decision. So we are still doing the interviews, a social distance interview, but I think everyone's informed that they understand what state that we're in.
For us, it's a little different because we're a 4-season operation, so we don't really have seasonals. We do staff up with a lot of young people during the summer and have a little bit more temp hiring. So we have a little bit of a peak hiring cycle during the summer because we operate about 85 summer camps, and then we have a family camp up in the Sierras that we need to staff. So a lot of our rec staff are sort of temporary. Our model is that we have core permanent staff, and then those who do programming are actually temporary employees. They get paid while they program. So a lot of them are being used now for this emergency childcare operation. But, you know, at some point, we're going to come upon summer pretty quickly. We just learned while I was on this call that the school district, our school districts in all Bay Area counties are now going to be closed through May 1st. You know, the school year ends for us out here around the third week of May, and we start our summer camp program the first week of June. So this is all, you know, going down pretty quickly. So we don't know what the status of our summer camp program is going to be yet. We don't know what the status of our family camp, which, you know, hosts about, I think about 150 families, about 500 people a week up in the Sierras in this beautiful location. So it's a little bit of wait and see. We are hiring. We are in the middle of a custodial relief, which is sort of an as needed or peak use of custodians. We cannot hire. We simply cannot have enough custodians right now. So that's been, you know, our primary hiring focus. And our youth workers, I believe, have gone through an interview cycle, which is really more for them and educational. We're not, you know, it's not a super selective or stressful interview process for us. It's just to give our kids the experience of interviewing. I think most of that has happened, and some of it did happen since the shelter at home order. So we were using a socially distant interview strategy, some virtual interviews, and then some spacing. But like with Mitch, a lot of that is on hold until we figure out what's what. And no volunteer programs right now.
One clarification, we hire our seasonals into 2 batches. The first batch we interviewed are on a pause. We're now interviewing for the second batch. They have different start dates, so I just wanted to clarify the issue of our seasonals.
All right. Thank you so much, Mitch, Jane, and Phil, for joining us on such short notice for this really critical webinar. We've run out of time for any more questions, but we had tons of questions we were unfortunately not able to answer. City Parks Alliance is going to try to do more of this type of programming where we can just have people share what's going on. This is a situation that's changing from day to day. So we understand people will have a hunger for just hearing what their peers are doing, especially in leading edge cities that are on the forefront of this fight, like your own cities. So we're going to be wrapping up now. Thanks again to our speakers and to our moderator. For those of you in the audience, stay tuned for additional webinars that'll be coming up. You can visit our events tab at cityparksalliance.org for information about upcoming webinars. And if you'd like to be notified when registration opens for future webinars that are open to the public, subscribe to our email list at cityparksalliance.org/subscribe. Within the next week, you'll receive an email with links to today's recording as well as related resources. For those who were not able to get on this because we maxed out, we will be sending the recording out to every person who registered. So don't worry about that. And thanks to all of you, our attendees, whether online with us today or catching the recording, please take a minute to fill out the short evaluation that will pop up after the session concludes, and keep up the great work for what you're doing for our nation's urban parks.
Thank you.
Amen.
Thank you.
Thank you.
Thank you.